Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 44th lecture on pathology. Today, day 10 of Neoplasm. Dear audience, today's topic is carcinogenesis by ionizing radiation and ultraviolet ray. Carcinogenesis by radiation and ultraviolet ray. Carcinogenesis by indirectly acting carcinogen. Carcinogenesis by indirectly acting carcinogen. Carcinogenesis by viruses. Carcinogenesis by radiation and ultraviolet ray. Carcinogenesis by indirectly acting chemical carcinogen. Carcinogenesis by viruses. Effect of tumor on host. And effect of host on tumor. Dear audience, again, today's topic: carcinogenesis by radiation and ultraviolet ray. Carcinogenesis by indirectly acting chemical carcinogen. Carcinogenesis by viruses. Effect of tumor on host. Effect of host on tumor. First come to carcinogenesis by radiation and ultraviolet ray. Dear audience, we know carcinogen is the agent that causes neoplasm, either benign or malignant. And we also know molecular basis of carcinogenesis is genetic mutation. That is, genetic mutation is the molecular basis of carcinogenesis. And we also know after genetic mutation in the cell exposed to certain appropriate carcinogen, the cell is known as initiated cell. That is, after genetic mutation by carcinogen, the cell is known as initiated cell. Now come to how radiation and ultraviolet ray causes neoplasm. Radiation and ultraviolet ray are highly reactive electrophile. These are highly reactive electrophile. That is, these are electron deficient. These are electron deficient. These electron deficient radiation and ultraviolet ray is known as electrophile. These electron deficient carcinogen reacts with the electron rich site in DNA of the cell. Reacts with electron rich site of DNA of cell. As the electron deficient electrophile reacts with the electron rich site of DNA, there is genetic mutation. There is genetic mutation. And due to genetic mutation in the cell, after having genetic mutation, the cell is known as initiated cell. So, when the electron deficient electrophile reacts with the electron rich site, the DNA, there is genetic mutation. And the cell with the genetic mutation is known as initiated cell. So, this is initiated cell. Dear audience, you know, if the initiated cell progress, there is tumorigenesis. So, the initiated cell formed due to exposure of carcinogen may progress. When it progresses, there is tumorigenesis. Again, radiation and ultraviolet ray, these are highly reactive electrophile. That is, these are electron deficient. It reacts with the electron rich site of DNA of the targeted cell and causes genetic mutation. When there is genetic mutation in the target cell, this cell is known as initiated cell. This initiated cell may progress, and so there is tumorigenesis. This is the tumorigenesis or carcinogenesis by ultraviolet ray and radiation energy. Now come to carcinogenesis by indirectly acting chemical carcinogen. Carcinogenesis by indirectly acting chemical carcinogen. Carcinogenesis by indirectly acting carcinogen. Dear audience, you know, indirectly acting carcinogens are the inactive carcinogens. This requires metabolic activation for tumorigenesis. As it requires metabolic activation for tumorigenesis, it is also known as procarcinogen and also known as ultimate carcinogen. Indirectly acting chemical carcinogens are inactive carcinogen. It undergoes metabolic activation. And this metabolic activation of indirectly acting chemical carcinogen occurs in endoplasmic reticulum. Suppose this is the targeted cell, this is nucleus, and these are the endoplasmic reticulums. Within the endoplasmic reticulum, the indirectly acting carcinogens undergo metabolic activation. With the help of an enzyme, this is known as monooxygenase. So, with the help of monooxygenase enzyme. This carcinogen is activated in the endoplasmic reticulum by monooxygenase enzyme, and this monooxygenase enzyme is cytochrome P450 enzyme dependent. This monooxygenase enzyme is cytochrome P450 enzyme dependent. Derodens again, this indirect-acting carcinogen is inactive carcinogen. It requires metabolic activation with the help of enzyme monooxygenase, and this monooxygenase enzyme is cytochrome P450 enzyme dependent, and this enzyme acts upon the indirectly acting chemical carcinogen in the endoplasmic reticulum, and then there is activation of the indirectly acting carcinogen. When indirectly acting carcinogen become activated, it becomes highly reactive electrophile. That is, after activation in endoplasmic reticulum, after activation in endoplasmic reticulum, the carcinogen becomes highly reactive electrophile. That is, after activation, the indirectly acting chemical carcinogen become electron deficient. It reacts with the electron rich site of DNA of the targeted cell. There is genetic mutation. When there is genetic mutation, then the cell is known as initiated cell. Initiated cell. And the initiated cell may progress and causes tumorogenesis. Progression of initiated cell and tumorogenesis. Derodens again, indirectly acting carcinogen is activated by enzyme monooxygenase in endoplasmic reticulum of the targeted cell, and this monooxygenase enzyme is cytochrome P450 enzyme dependent. After activation, the indirectly acting carcinogen becomes electron deficient, and this electron deficient carcinogen reacts with the electron rich site of DNA of the target cell, and the cell is converted to initiated cell due to genetic mutation, and this initiated cell may progress and causes tumorogenesis. Dear audience, now come to carcinogenesis by virus. You know, the viruses associated with oncogenesis or tumorogenesis is known as oncogenic virus. There are DNA oncogenic viruses and RNA oncogenic virus. Carcinogenesis by viruses. First come to carcinogenesis by DNA oncogenic virus. by DNA oncogenic virus. Suppose this is target cell, this is nucleus, targeted cell, and this is the receptor for virus, and this is virus. First, DNA virus attaches with the receptor present on cell membrane of target cell. This is the virus attaches with the receptor. Then entry of DNA virus in cell cytoplasm. The virus enters in the cell cytoplasm. After entering in cell cytoplasm, the virus enters into the nucleus. Entry of virus from cytoplasm to nucleus. This is the entry of virus in the nucleus. After entering into the nucleus, the DNA virus is incorporated with the host genome. Incorporation of DNA virus with the host genome. That is, the DNA virus is incorporated with the DNA of the host chromosome. So this is the incorporation of the DNA virus with the host genome. Then this virus controls the host DNA. DNA virus, after incorporation with host genome, controls the host DNA. This control of host DNA by viral DNA is nothing but genetic mutation. So there is genetic mutation. And when there is genetic mutation, this cell is known as initiated cell. Initiated cell. And this initiated cell may progress and causes tumorigenesis. Progression and tumorigenesis. Dear audience, again, the DNA virus first attaches with the receptor present on the cell membrane, enters into the cytoplasm, then it enters the nucleus and is incorporated with the host genome. Then it regulates the host genome, and this is nothing but genetic mutation. When there is genetic mutation, this target cell is known as initiated cell. The initiated cell may progress, and so there is tumorigenesis by DNA virus. Now come to tumorigenesis or oncogenesis by RNA virus. by RNA virus. Dear audience, if this is the target cell, this is nucleus, and this is the receptor, and this is the RNA virus. RNA virus attaches with the receptor present on cell membrane, then entry of virus in cell cytoplasm. From the cell cytoplasm, virus enters into the nucleus. So this is the entry of virus in cell cytoplasm. Later on it enters into the nucleus. Then entry of RNA virus in nucleus. Dear audience, after entering into the nucleus, the RNA virus is converted to DNA virus by its enzyme reverse transcriptase. After entering in nucleus, the RNA virus is converted to DNA virus by its enzyme reverse transcriptase. By its enzyme reverse transcriptase. After conversion to DNA by its reverse transcriptase, the virus is incorporated with the host genome. After conversion to DNA, the virus is incorporated with host genome, and after incorporation, the virus controls the host DNA. Virus controls the host DNA. So, after conversion to DNA, it is incorporated in the host genome, and after incorporation, the virus controls the host DNA. There is genetic mutation, and formation of initiated cell. Now, after genetic mutation, this cell is initiated cell, and this initiated cell may progress, and there is tumorogenesis. Dear audience, DNA virus is incorporated in the host genome, but RNA virus cannot incorporate in the host genome before conversion to DNA by its enzyme reverse transcriptase. This is oncogenesis or tumorogenesis by oncogenic viruses. Now come to effects of tumor on host. Dear audience, if anybody suffers from cancer, cancer is a tumor, is a malignant tumor. There are some effects of this cancer, or there are some effects of this tumor on the host, and this is effect of tumor on host. What are the effects? The effects may be pressure effect, hormonal effect, bleeding, ulceration, and secondary infection. Effect may be cancer cachexia. Cancer cachexia. These are the effects, pressure effects of tumor on host, hormonal effect of tumor on host, bleeding, ulceration, and secondary infections, cancer cachexia. Dear audience, first come to pressure effect of tumor on host. Examples of pressure effect of tumor on host. Examples: pituitary adenoma may exert pressure on the pituitary gland, and ultimately there is pituitary insufficiency. Pituitary gland exerts pressure on gland, and thereby there is pituitary insufficiency. Dear audience, suppose this is pituitary gland, and within the pituitary gland there is adenoma. Pituitary adenoma. As the adenoma is gradually will increase in size, it will exert pressure on the gland. Due to pressure exerted by pituitary adenoma on the gland, there will be pituitary insufficiency. This is an example of pressure effect of tumor on host. Pituitary tumor may exert pressure on optic chiasma. Dear audience, you know pituitary gland is present in the sella turcica of the sphenoid bone. If there is pituitary tumor, the pituitary tumor may exert pressure on the optic chiasma, and if it exerts pressure on the optic chiasma, there is chance of blindness. Chance of blindness. So this is another example of pressure effect of tumor on host. Dear audience, you know benign tumor of meninges is known as meningioma. If anybody suffers from meningioma in the intracranial space, this benign tumor of meninges may exert pressure on the brain. Pressure exerted on brain by meningioma. So pressure exerted on brain by meningioma is another example of pressure effect of tumor on host. Now come to hormonal effect of tumor on host. Hormonal effect of tumor on host. Dear audience, you know insulin is secreted by beta cell of islets of Langerhans of pancreas. If anybody suffers from beta cell adenoma, there will be elaboration of insulin, and this insulin may lead to fatal hypoglycemia. This is hormonal effect of tumor on host. Example, beta cell adenoma of pancreas. What will happen? There will be elaboration of insulin. Elaboration of insulin. And this elaborated insulin will lead to fatal hypoglycemia. So this is the hormonal effect of tumor on host. This is an example. Now come to bleeding. Dear audience, suppose anybody suffers from gastric carcinoma. If this is gastric carcinoma, there will be bleeding. This is internal bleeding, and patient becomes anemic. Or if anybody suffers from colorectal carcinoma, there will be bleeding, there will be melena, and patient may develop anemia. So, bleeding in malignancy. This is an effect of tumor on host. Dear audience, now come to ulceration and secondary infection. Dear audience, if anybody suffers from a cancer in the skin or cancer in the stomach, during their expansion, there will be stressing on the surface. There will be ulceration on the surface. Expansile cancer in skin, stretching of skin due to expansion of tumor. And as there is stretching of the skin due to expansion of tumor, there will be compression of the cutaneous vessels. Compression of cutaneous vessels. As cutaneous vessels are compressed, there will be ischemia. And due to ischemia, there will be sloughing out of necrotic tissue, and there will be ulceration. And as there is ulceration, there is chance of secondary infection. Now come to another example of ulceration in tumor. expansion cancer in stomach, there will be ulceration on the surface of the gastric carcinoma. Why ulceration in surface of gastric carcinoma? Because the cancer will expand. Due to expansion, stressing on the surface of the cancer. Due to stressing, there will be compression of the blood vessels, and there will be ischemia, there will be ulcerations, and there will be secondary infections. Pyridines, expansion cancer in stomach is associated with ulceration in the surface of the gastric carcinoma. Why? Suppose this is the stomach and this is the expansile gastric carcinoma. As the carcinoma expands, there will be stressing on the surface of the cancer, and due to stressing, there will be compression of the blood vessels. Due to compression of the blood vessels, there will be ischemia, and ischemia is associated with ulceration, and ultimately there is a chance of secondary infection. Dear audience, now come to another defect, cancer cachexia. Respected audience, if anybody suffers from cancer or malignant tumor, in advanced case, the patient become lean and thin. In advanced cancer, patient becomes lean and thin. Why patient becomes lean and thin? Due to progressive loss of body fat. Due to progressive loss of body fat. Again, in advanced case of cancer, patient become lean and thin due to progressive loss of body fat. And the patient suffers from asthenia, anemia, and anorexia. So in advanced case of cancer, patient suffers from asthenia, anemia, and anorexia. This wasting syndrome in cancer is known as cancer cachexia. This wasting syndrome in cancer is known as cancer cachexia. So, asthenia, anemia, anorexia, lean and thin due to progressive loss of body fat is wasting syndrome, and this wasting syndrome is known as cancer cachexia. Now come to what is the cause of cancer cachexia? Cause of cancer cachexia. Dear audience, the cause of cancer cachexia is not clearly known. Not clearly known. But there are suggestions. There are suggestions. What are the suggestions? Tumor necrosis factor alpha derived from macrophage of cancer bearing patient. Tumor necrosis factor alpha derived from macrophage of cancer bearing patient is associated with progressive loss of body fat. Is associated with progressive loss of body fat. Here it is again. What is the cause of cancer cachexia? Not clearly known, but there are some suggestions. One of the suggestions, tumor necrosis factor derived from macrophage of cancer bearing patient is associated with progressive loss of body fat. Another suggestion, cancer bearing patient usually suffers from depression. So depression of patient is associated with anorexia. Depression of patient is associated with anorexia. And due to anorexia, there is anemia and there is asthenia. Due to anorexia, there is anemia and there is asthenia. So, depression of cancer bearing patient, there will be anorexia, and anorexia is associated with anemia and asthenia. Respected audience, this is all about the effect of tumor on host briefly. Now come to effect of host on tumor. Effects of host on tumor. Defense of host is the effect of host on tumor. Defense of host is the effect of host on tumor. And this defense of host is nothing but the immune response of host to tumor. It is the immune response of host to tumor. Now come to what are the cells associated with the immune response of a host to tumor. Cells associated with immune response of host to tumor. What are the cells? Cells may be macrophage, cells may be natural killer cell, and the very important is cytotoxic T cell. Cytotoxic T cell. So T cell, NK cell, macrophage, these are the cells associated with immune response of a host to tumor. Dear audience, now come to examples of immune response of a host to tumor. Examples of immune response of host to tumor. Dear audience, we know some malignant tumors are infiltrated by lymphocytes. Some are not infiltrated by lymphocytes. The prognosis of the tumor infiltrated by lymphocyte is better than the prognosis of tumor not infiltrated by lymphocytes. Prognosis of tumor infiltrated with lymphocyte is better than the prognosis of tumor not infiltrated with lymphocytes. So the tumors that are infiltrated with lymphocytes shows better prognosis than the tumors not infiltrated by lymphocytes. Now come to some examples of tumor that are infiltrated by lymphocytes. Tumors infiltrated with lymphocytes. One is seminoma, the malignant tumor that occurs in testes, seminoma, dysgerminoma, a solid malignant tumor that occurs in ovary. These are infiltrated with lymphocytes. Now come to another example of immune response of host to tumor. Dear audience, you know the individuals with immunodeficiency is more prone to develop neoplasm, is more prone to develop cancer. As for example, those who suffers from AIDS, there is immunodeficiency and there is chance of development of Kaposi sarcoma. So individuals with immunodeficiency are more prone to develop tumor. So these are the examples of immune responses of host to tumor. Dear audience, today I have told you about the carcinogenesis or tumorigenesis by radiation and ultraviolet ray, carcinogenesis or tumorigenesis by indirectly acting carcinogen, by RNA virus, by DNA virus. I have told you about the effects of tumor on host, pressure effect, hormonal effect, bleeding, ulceration and secondary infections, cancer cachexia. And lastly, I have told you about the effect of host on tumor. This is nothing but the immune response of host on tumor. To adapt to this, thanks all.